As we learn to live with COVID-19, our healthcare protocols must be remodeled. If COVID-19 is indeed endemic, having 200 or more cases may not be an unusual thing at all. During an influenza season, our daily infection rates can go up to as high as 1,000 a day. Imagine we treat influenza like we treat COVID-19. This is what will happen. We will put everyone suspected of influenza infections through PCR tests, and then long isolated stays in hospitals. And then everyone they come into contact with will be quarantined. 1,000 cases a day. This will disrupt the lives of many people. Further, hospital beds will all be filled, and many other patients who are sicker will be turned away. The healthcare system will not be able to cope, and that is clearly not the way to deal with an endemic disease. So if we want to live with COVID as an endemic disease, we cannot carry on with the current healthcare protocols. They need to shift closer to how we treat influenza today, without extensive contact tracing and quarantine in dedicated facilities, and hospitalizing only those who are very ill. But that can only happen when the likelihood of developing very serious or life-threatening disease as a result of COVID-19 infection has been significantly reduced by effective vaccination of our population, especially amongst the vulnerable. With our current rate of vaccinations, we have started to take the first transition step to remodel our healthcare protocols. As of last week, we made the following changes. First, greater use of community care facilities instead of hospitals. Vaccinated individuals aged between 45 and 59 who tested positive for COVID-19 and show no or mild symptoms can be directly admitted to community care facilities instead of going first to hospitals. So these community care facilities currently is, for example, is NTUCD resorts as well as CSC Loyang. This was already the practice for all cases aged between 17 to 45 years, but we are now expanding the protocol to people up to 59 years old. And with this change, we expect up to 60% of infected cases to recover in community care facilities instead of in acute care hospitals. Meanwhile, we will plan for the next step, because this is just the first step. We'll plan for the next one, where perhaps 80% can be admitted to community care facilities, and some can even start to recover at home. Second change, we have shortened the length of stay in hospitals and community care facilities. Our tests have shown that the viral load in infected persons who are fully vaccinated falls very rapidly to a very low level after 9 days. Previously, most people generally were discharged only after 21 days. We are now discharging fully vaccinated persons after 14 days from the onset of illnesses, with a 7-day leave of absence in addition, so long as their tests show that they are COVID negative or have very low viral loads. We are reviewing our policy to allow fully vaccinated patients to be discharged even earlier and to complete the rest of the isolation period at home if their home environment is suitable. Third change is the greater use of home quarantine. For fully vaccinated persons, they can now serve their quarantine at home instead of a dedicated government facility, provided that their home is suitable for isolation. We expect up to 40% of persons under quarantine can serve their quarantine at home, and this will go beyond 50% in the coming few weeks as more people get vaccinated. These are amongst the first steps that we will take in the healthcare transition. In the meantime, what we are experiencing in this current wave of transmission is also valuable because we are also witnessing a palpable shift in our collective psychology. The first, I think, is a shift away from always focusing on infection numbers. We used to get a shock when we see high daily numbers because this will mean a week or two from then, we will see more severe illnesses and deaths. However, in recent days, that mental link is starting to be broken, as we know that with vaccinations, high infection numbers need not necessarily mean more sickness and deaths. Many people are now rightfully focusing on the number of people with severe illnesses. As of today, despite the higher infection cases over the past few days, that number is 14 and does not threaten our hospital capacity. Many friends, including members of this House, have been texting me, asking me, why don't we publish the number of people with severe illnesses so that we know that vaccination works? Actually, the media have been publishing these numbers every day for quite a while now. But our attention is always on the vaccination, on the infection numbers. But it is good that the attention is now shifting. I wouldn't say there's a huge psychological shift, but I think the shift is starting to happen. A second shift is a greater acceptance of differentiated safe management measures between those who are vaccinated and those who are not. There have been many calls to do this. Mr. Xie Yao-Chen has also asked about this. This is something which the MTF has always intended to do, and that was why we decided on the 2-5 rule for restaurants when the KTV cluster broke out. But it was scuttled with our reversion to phase 2 heightened alert. When our whole society is very highly vaccinated and we have transitioned to living with COVID-19, we should make very little differentiation between the vaccinated and the unvaccinated. But during this period of transition, when we are still building up our resilience, differentiation by vaccination status is a practical way to open up some activities first while protecting those who are still vulnerable. MTF will visit this during our Phase 2 Heightened Alert Midpoint Review, and Minister Lawrence Wong will speak more about that later.